it was first clear to me that I was dealing with depression and anxiety when I was in, I would say, middle school. I pretty much dealt with the stigma of being labeled as crazy to go see the counselor, the school counselor. The counselor made me feel very comfortable because the counselor, basically complimented me, which was something that I didn't get a lot of, and said that I was strong for even making the decision to see the counselor. When I got diagnosed with lupus was when I was at my lowest. I started to self-medicate, drinking a lot to escape the feelings of depression and anxiety surrounding this new diagnosis. And I felt like the only way for me to deal with that at that point was to check myself into a hospital to get help. As I was waiting to be checked in to the hospital, one of the staff members were walking amongst us, the patients that were there, and he made a comment on the cell phone that he was at his job again dealing with a bunch of crazy people. And I overheard the young man, and it really bothered me, and I stopped him and I said, how could you say something like that? I said, everybody deals with issues, and some people deal with more severe issues than others.
My first experience of symptoms of my schizoaffective and bipolar disorder was in college. I don't know, I just started experiencing symptoms of psychosis, delusions, and paranoia.
During the crisis time in Madison, I recall the staff being very open and honest with us. And Cheryl and I then, I guess, were able to sort of come to terms with things. I think the stigma part was probably in us more than the providers.
I got to a point where I was stable enough to start seeing a therapist. And I did go through probably about 6 or 7 therapists before I found the right one. One therapist I saw, when I told her one of my paranoid thoughts and trying to give her an idea of what was going on with me, she just looked at me and was like, "You really think that?" Mary and I just really connected right away. 2 minutes into our conversation, I knew that we were going to be able to work together.
When we started talking and we talked about how hopeful things could get for her and what she could accomplish, she became much more interested in delving into what she could do and participate.
The doctor I was supposed to see, that I'd waited 5 months to see, went out to have emergency surgery. So I had to see somebody else. And my gosh, I won't be going back. I mean, the first thing he said was, "Wow, you take a lot of medication." I'm like, "Yeah, I do." That was his first comment. He didn't comment on the other reasons why I was there. I've had a psychiatric illness. I've had bipolar disorder my entire life and post-traumatic stress disorder. And I really think part of it was he was really pretty uncomfortable with me because I was open about what was going on with my mental health. And I know from the first day that we met that you were different. You never looked at my meds and say, "Oh, why do you take all of those?" And you never, gave it this gaze like, "What's this person doing here?" I never sensed that from you. It was always a sense of understanding. It was a sense of peace. You really told me that I knew my body and that you trusted what I knew because I was the expert in my body.
My mother was a psychiatric nurse for years and years. And I was I grew up in that realm. I was exposed to people with mental illness. And so it doesn't really scare me or make me apprehensive about talking to someone or being involved in their care. When I started medical school, I was planning on going to psychiatry. One of my first rotations was an inpatient psychiatric rotation, and it was a very negative experience. And I say that, and again, now being an orthopedist, a lot of people think what I do is opposite, and it's really not. Our mental health and our physical health are linked.
I learned the hard way. She kept coming back and we'd have the same conversation. "I can do something about your tics, but I don't know that I can do anything else. After all, I'm the neurologist here. Isn't that what the psychiatrists do?" And then it was like, I could see the light go off when I made that statement. First time I got fired by a family because they were not happy with my care. And then I started to read about Tourette's and learn a little bit about it and learn just a little bit about it. When I met Ellie, she really helped me understand that you can do a lot for a patient by reframing the stigmatizing disorder that they think they have in a way that makes them feel comfortable with who they are and not who society expects them to be.
When I came to Dr. Ingles, I specifically was seeking him out because of his reputation, and everything I had heard about was delivered. I think the big things that I appreciated is he listened to me. He didn't rush me through what was going on. My opinions were valid and important to him. It was really more about making me the agency of the agent of my own care and my own recovery that I think was different in the way that you practiced.
After that situation that I dealt with, I ended up going to a hospital that was able to look at both my physical and my mental state of being. The staff were just really encouraging and saying, hey, you know, it's good that you came to get help, and we're here for you. Is there anything that you need? They were just really, it felt like a second home for me. I'm currently seeing a counselor now, and my counselor disclosed to me that she has lupus, and she was very understanding as to the depression and the anxiety, the things that I've been dealing with. She shared with me her story as far as her treatment, the things that she's been doing to get through or to deal with, to cope with the disease. That really made me hopeful, because to see her in a role of, you know, taking care of other people and helping other people, and have this disease that I have, just really gave me a lot of hope. I'm paying it forward in a way. I was helped out at a time that I really didn't see the light. I didn't know where I was going to go. I thought it only fair and only just that I helped someone the way that I was helped.
We need to look at the person themselves and see them as an expert in many areas and give them the credibility and the respect, because they have gone through so much and they know the limitations often, what they can and can't do. And the other thing is to recognize in yourself as the person treating this individual that you too have the biases. I continue to make that mistake. I can continue to make a snap judgment about someone and be proved, even this past week I did that, proved totally wrong.
I was going in to get a TB test at the hospital, and the nurse there giving me the TB test, she was looking through my chart and all the medications I took, and she said, oh, schizoaffective disorder, is that something to do with brain trauma? And she really didn't have any idea what schizoaffective disorder was. So instead of getting mad at her, I've been able to learn how to educate people and help make them aware of what mental illness is. And I felt like I was in a good place to be able to be assertive and stand my ground without feeling angry towards her, because really she didn't know.
When we need to speak with other doctors, providers, it's no big deal anymore. I couldn't say that 4 years ago, but I can say that now. Because Mackenzie's really opened that door for us. She allows credibility to happen for others, because I think other people in need who are having problems, depression, whatever, can see her and really relate to her and see that, oh gosh, I'm not stuck. I don't have to live in the basement for the rest of my life. She gives people hope.
We get fixed on positives and negatives about ourselves, and we want things fixed. And I think that it becomes dangerous as clinicians to get locked into what we think needs to be an outcome. We're in a very privileged position because the people that we're supposed to care for are extremely vulnerable and they're extremely suggestible, and they come to us because they believe that, not that we have a wealth of information and knowledge, but that we're also wise and that we're going to do the right thing for them. And I think the psychiatrists need to learn just a little bit more neurology, and we have to learn a lot more psychiatry to best take care of, I think, everybody.
I can tell you the most helpful intervention hasn't been any med, it hasn't been any therapy, It's been connecting with other people who walk down the same road and recognizing that it will get better. So I get excited about approaches that focus on making those connections and helping people to really identify how can they be agents in their own care, what symptoms are most important to them. I think the illness is irrelevant, but the experience has got to be the same for recovery, right?
Every year I get older, I kind of still get much more looking at the bigger picture. And I think if we could overcome just the apprehension to just talk about mental health issues, it would be so much easier. And I spend a lot less time talking about the technical issue about, say, replacing a knee, and more about learning about the person so I can get a better idea of how it impacts, you know, the whole thing and their whole life. That's kind of why we all did this. And sometimes I think physicians and a lot of people in healthcare kind of forget some of those things. And sometimes I think forget that too. And it's a reminder to go back about it's having empathy and helping take care of patients. And really it's an honor, and it's a blessing to be able to do it.